Hey, everybody, it's Dr. Jonah Yakel, your natural health care practitioner, and I just wanted to welcome you to the first in our functional medicine series. Every couple of weeks over the next 2 to 3 months, I am going to be sharing on one of the top health challenges that I see every day in my practice. And I thought no better place to start than talking about inflammation. The reality is this is something that we all deal with. It's something that we all struggle with. We all have. You can't walk on this planet without having or experiencing some form of inflammation, especially as we age. The problem is that inflammation, or at least I should say chronic inflammation, is at the root cause or the source of every disease process that we experience, including just aging in general. If we want to age faster, all we need to do is live a very inflammatory lifestyle. So for most of us who are value health and we want to maintain our health as long as possible, well, we want to live a very anti-inflammatory lifestyle. And that's really my purpose for today's video, is to talk about, okay, what are some natural strategies that we can be incorporating into our own lives every day to drive down inflammation. And as I mentioned before, this is something that is at the root cause of everything. So whether we're talking about heart disease, whether we're talking about cancer, whether we're talking about joint pain, I get a lot of people in my office dealing with pain, and that is an inflammatory issue. So musculoskeletal pain, even disc injuries, those all have a huge inflammatory component. Digestive issues. Really think about anything that ends in an itis, so gastritis, that's inflammation of the gastrointestinal tract, or arthritis, that's inflammation in the joints. Those are inflammatory issues. It's the skin, things like psoriasis and eczema, autoimmune conditions. These are all linked up to inflammation. And as we're learning more and more, it turns out inflammation is playing an enormous role in our brain health. Even things including mood disorders, so anxiety, depression, ADD, ADHD, even things like bipolar and schizophrenia are being linked to inflammation in the brain. And then, of course, cognitive decline, Alzheimer's, dementia. Alzheimer's is the fastest growing disease process in America. It's set to triple over the next decade or two. Furthermore, it is the most expensive of all the health challenges to treat. And it's blowing up, and it's an inflammatory condition. So again, I have found in 12 years of practice now, both in my clinic and via my own health journey, that really a major key to maintaining our health and to living a high quality life is learning how to manage, or even how to master, inflammation. And so that is ultimately what we're setting out to talk about today. So what I'd like to do is share with you a slide here, a couple of slides really, but I think first, one of the most important things to remember here is that inflammation is actually part of the body's natural healing process. So when we talk about inflammation, we just think about how bad inflammation must be, but the reality is that inflammation is part of the healing process. It is required in order for our body to heal. So, if you imagine, stepping off a curb and you twist your ankle and the ankle swells up. I'm sure everyone's had that experience before. I know I've done it multiple times myself. But that swelling up, that is what we call acute inflammation. So the body immediately goes into an inflammatory response. And the inflammation is there for several reasons. I'm sure many of which we don't know why, but a few of the things that we know that it does is, one, it creates a casting system. So it's protecting the area so that we don't further damage it. We think about putting on walking boots. This was our body's own intelligence creating the inflammation to guard and protect the joint to begin with. The second thing inflammation does is it triggers a pain response. So it lets our brain know that we have an injury, which of course this is beneficial, because then that tells us to stop doing what we're doing, get off the ankle, let it heal. Now, I will note that you cannot experience pain without inflammation. That is part of the pain process. On the other hand, you can have inflammation and not experience pain. So I'm talking about the ankle, but If we have an inflamed brain, for instance, or our GI tract is inflamed, a lot of things can be inflamed, and we don't experience the pain just because we don't necessarily have the nerves correlating with the pain. But so it's creating stability, and it's guarding and protecting. Two, it's actually triggering the pain signals. But a third is that inflammation has a reverse polarity to all of the healing nutrients, all the antioxidants, the minerals that our body needs to actually heal and repair. So what it does is starts drawing in all of the surrounding nutrients our body needs to heal that area. So we cannot actually heal appropriately without inflammation. So it's not a matter of, well, it's bad, let's just turn it off. It's that we need to complete the healing process so we no longer need to stay chronically inflamed. So as I'm saying, it's not that inflammation is bad. However, if we are chronically inflamed, what that in essence is telling us is that we are experiencing damage to the tissue faster than we are healing the tissue. So what happens is that we are chronically injured. Our body is trying to heal, but it never completes the healing process. And this is where we start to run into problems. Acute inflammation is not bad. Chronic inflammation can be problematic. So where do we get how do we get inflamed? And one of the first things that will pop up is stress. And we don't really think of this, but anytime we experience stress in our life, we start secreting cortisol and stress hormones, which again, for a short period of time is not inherently bad, but long term, that stress and those hormones that are being pumped in the system consistently actually can lend to long-term inflammation. Blood sugar issues. This is another cause of inflammation. So it's our diet, it's what we're eating. And I'm not even talking about us eating, processed foods. I'm talking about that when we eat carbohydrates, our blood sugar goes up. And anything that goes up must come back down. So when our blood sugar crashes back down, we actually release more cortisol into the bloodstream, which cortisol, as you might be familiar, is our stress hormone. But cortisol is also responsible for balancing blood sugar. So every time our blood sugar drops, we get a surge of stress hormones, which keeps us in a chronic state of stress. Furthermore, but it also drives more inflammation. Leaky gut, so food sensitivities, especially things like gluten and dairy and corn and soy, and all these grains and all these processed foods, they damage the gut. And what we now learn is that if our gut is inflamed, well, our brain is inflamed, and if our brain is inflamed, our gut is inflamed. And the reality is once we create any degree of inflammation, it just starts cascading and causing problems throughout the entire body as we just become more and more inflamed. Obviously, poor diet, not getting enough antioxidants to fight the inflammation. Any kind of trauma or injury is going to cause inflammation. A slip, a fall, maybe I was in a fender bender, a car accident, thrown from a horse, like any kind of physical trauma is going to cause inflammation. Poor circulation, which is this we're going to see if we're not exercising, we're sitting in a desk all day long, we're not very mobile. Stress reduces circulation, high blood pressure reduces circulation. Hormone problems like thyroid problems will have an impact on circulation. But if we're not getting circulation to the tissues, well, they can't heal properly. So we become chronically inflamed. Autoimmune diseases, these inherently are inflammatory conditions. So again, if we're not addressing the underlying cause, then we're stuck in a chronic inflammatory state. And then, of course, chronic immune burden. So if we have any fungal infections, candida, Lyme's, mold, any kind of stealth pathogen, so any kind of fungus, any kind of bacteria, any kind of virus that is chronic and simmering under the surface that so many of our healthcare practitioners overlook and don't even go looking for, they can be causing a chronic state of inflammation. Add in drugs and alcohol, pollution, like we don't live in the Garden of Eden anymore. So, we are bombarded by toxins every single day in our world. So these are all things that can drive a chronic inflammatory response. And as I go down that list, it's like, most of us are experiencing most of those things to some degree. And then, of course, systemic inflammation. So once one area becomes inflamed, it starts inflaming other areas, and it just doesn't shut off. So we become more and more inflamed. and it just keeps building and it keeps building and it keeps growing. And then that's, over years and even decades, this is how we end up with things like heart disease. This is how we end up with some of the more chronic health conditions that are being driven by inflammation. So, that being said, how do we know if we're inflamed? Well, it's quite, one, inflammation, it can show up anywhere, and it can present itself symptomatically as all kinds of things. The most obvious one is going to be pain. If you have pain, you're inflamed. But if you're dealing with chronic pain, neck pain, headaches, back pain, knee pain, hip pain, foot pain, plantar fasciitis, these are all inflammatory conditions. And I found, again, so consistently that if we can drive down the inflammation, the pain oftentimes goes away. And, I see this as in my office all the time. I'll look at someone's x-rays, and, one person, I might look at their x-rays and their x-rays look beautiful. However, because of the inflammation they're experiencing, they have a lot of pain. On the other hand, I've had people in my office who have very severe arthritis and degeneration in their spine, but if they keep the inflammation down, they can live a pain-free life. So, just because degeneration is already set in, it does not mean that we actually have to experience pain. So if we can manage the inflammation, the pain will go down. Alzheimer's and dementia, we mentioned that earlier. That is an indication of inflammation, neuroinflammation in that case. Depression, anxiety, as I mentioned, schizophrenia has been linked to a massive inflammatory condition. And when the inflammation is brought down, the symptoms are reduced. ADD, ADHD, bipolar, cardiovascular disease. So people dealing with high blood pressure, people dealing with high cholesterol, that is almost always the result of an underlying inflammatory condition. I mentioned digestive problems, diabetes, hormonal issues, so thyroid, adrenals, ovaries, testes, all of these hormonal imbalances can be driven by inflammation. And then what happens is once they set in, it causes more and more inflammation, which makes us basically feel worse and worse and worse. Allergies and asthma, even things like cancer, these are all things that drive or symptoms of inflammation. So it's like, okay, well, we know what the source is. We know what to be looking for. Well, what do we do to deal with the inflammation? Now, here's what I found, that about 80% of the time, most people can manage their inflammation on their own. There are things that we can be doing in our own lives to empower our health, ultimately to help our body heal and recover. And these are things that I do every day. And I don't miss a day. So here are some of the tools that I use to master inflammation in my own life. First and foremost, we have to learn how to reduce the stress in our life. And I'm going to say this list is probably from the hardest to the easiest things to be doing in our life, because most of us, at least I can speak for myself, we live highly overwhelming lives. We're juggling so many responsibilities. We're dealing with kids and with parents and jobs and finances and, all of these different things that we're trying to hold up all at once. And we keep ourselves in this chronic inflammatory state. We keep ourselves stuck in the sympathetic nervous system. So self-care is probably one of the number one things you can do to support inflammation. And what this is for everybody is a little bit different. So, this can include doing things like yoga, Pilates, integrating meditation and prayer into our lifestyle. Just really spending time every day recharging the battery. In essence, this could be focusing on our diet. This could be taking supplements. This could be getting to the chiropractor, getting some flow sessions, or maybe even getting acupuncture or massage. Like, these are all self-care programs that we need to be experiencing, making sure we're getting plenty of sleep every night, that we're not staying up too late, that we're not getting up too early, implementing things to make sure that the sleep we get is great sleep. So self-care is number one. Number two is making sure we get out the inflammatory foods. So any kind of low carb, paleo-like diet. I've been on a ketogenic diet for the last 2 years. I feel great. It's probably the most anti-inflammatory diet known. However, I find again that for the majority of my clients, they don't have to go that far. we can just do a paleo diet. So getting rid of the grains, going low carb, getting off dairy, getting off the most common inflammatory foods can make an enormous difference for bringing down inflammation. Healthy fats, it turns out that just like sugar drives up, sugar and carbs increases inflammation, well, healthy fats decrease inflammation. So this is focusing, getting more olive oils into our diet, avocado oils, walnut oil, coconut oil is a fantastic one. Even things like butter and animal fats can be very healthy, provided that they are organic and that they are coming from healthy sources, making sure that it's grass-fed, making sure that it's wild-caught. It turns out we're not just, we've all heard we are what we eat, but it turns out we are what we eat. So if I'm eating a fish that was raised on a farm eating corn, that's going to be very inflammatory. On the other hand, if I'm eating a wild-caught fish that's been eating, algae and other fish and, plankton or, whatever the fish are eating, like they're filled with these omega-3s, and the omega-3s are highly, highly anti-inflammatory. In fact, recently I started incorporating a great new test. It's fairly inexpensive. It's just a little finger prick, but it measures the ratio of omega-3s in our body and then correlates that to our inflammation levels. So it can actually predict our at what rate that we're aging, but it also tells us, are we even getting enough omega-3s? It's a huge way to decrease our inflammation levels. Adding in superfoods, so any kind of berries. So again, remember, we're trying to keep the carbs low. So we're going to go with, not a ton of fruit, 2 to 3 servings a day max, but we want it to be berries, strawberries, cherries, blueberries, blackberries, things like that. Turmeric is a very anti-inflammatory food, but remember, I almost always supplement this one because it is very unbioavailable. It's very hard for the body to absorb it. So one, we want to purchase it mixed with something like fenugreek or black pepper. I use MediHerb's version of turmeric because it's got fenugreek in it, which increases the absorption by about 40%, and you always want to take it with the fat. Green tea, I drink 2 to 3 to 4 cups of green tea a day. I especially like matcha. Ginger is highly anti-inflammatory. Rosemary, so any kind of herbs, grapeseed extract, that is a great option. And then any additional supplements. So again, we're picking superfoods, and then on top of that, we can supplement. So, when I supplement omega-3s, in addition to eating it. So, I shoot for at least 3 grams or 3,000 milligrams a day and go all the way up to 5 or 6, depending on how high my inflammation levels are at any given time. Frankincense or boswellia is a exceptional anti-inflammatory. As I mentioned, fish oil, collagen, there are so many different things that we can be doing in our lives to be driving down inflammation. So remember, it's these 5 things. You need to focus in on your self-care program, making sure you're bringing the stress down, get real clear and on point with the diet, getting out the grains, getting out the starchy vegetables, the carbs, the processed foods. Even dairy can be very inflammatory. Focusing in on high quality fats. So if we're taking the carbs out, we want to put some healthy fats in, getting in some really super powered foods, and then we pick up the rest through supplementation. And as I mentioned before, I have found in my practice about 80% of people, they do great just following those steps on their own. If you're one of the other 20%, if you're dealing with a more intense health issue, if you're dealing with autoimmune diseases, if you're already, moving into a state of dealing with being pre-diabetic or diabetic, or maybe you've got, high cholesterol, you're already moving into heart disease, you're showing signs of cognitive decline. Like once we hit that age where these things are starting to become a little bit more advanced, that's where it can be really useful to have a functional medicine practitioner on your side to supercharge all of this, to do any labs and get far, far more specific. So getting on a general program, that is necessary for every single one of us. But for those, if you're doing these things already in your life and you're not getting the results, you're not feeling as well as you could, that would be the time to reach out to a functional medicine practitioner. And like I said, I have said before, if you've got one, great. If you like them, if you trust them, use them. If you don't, I would be more than happy to support you in any way that I could, whether that just be fine-tuning your program or protocol, or finding the right lab test to find out what's going on, or even to just, dive deeper if no one's able to help you and find out what's going on with your health. We find that taking a functional approach can be very beneficial and help people get over the hump and find out what's actually at the root cause. So take all of these to heart, start implementing some of these in your life. If you're not getting the results that you would like to see in your health and in your life, don't hesitate to reach out, give me a call. I'll be more than happy to have a conversation, see how I might be able to help you. And stay tuned. 2 weeks from now, we're going to be coming out with our next video, which is going to be on managing blood sugar, which, again, that's that paleo. That's the step number 2. So how do we manage the blood sugar? This will be great for anybody struggling with pre-diabetes, diabetes, or someone who's even trying to lose weight or is overweight. But really, this is one of the number 1 things we can do in our life to start maximizing our health and really start tapping into our potential and feeling as well as we can. So thanks for tuning in. I will look forward to our next video coming out in a couple of weeks. And until then, I'm Dr. Yakel, and if I can serve you in any way, let me know.